right, there's a SOAP form for standard subjective objective assessment and plan, which you can then enter as part of the review. And finally, there's a patient instruction section for giving patients standard instructions on their health to take home with them. Once that's done, then the service can be coded. There's a diagnosis and service coding section here under coding. You click on that. It gives you a couple of categories in the fee sheet, a new patient column and an established patient column. This is a new patient, and it's a detailed visit. Could be one of these levels. They're different. It will pick the correct code for a comprehensive evaluation and put it down here. That would be 99205. You can enter a price if you're charging for that service. You can assign it to the provider at the individual level. If you leave it at default, it'll assume the logged in provider is providing the service. This is useful if someone else is doing the work, or if multiple providers perform multiple services and you need to separate those out. The next thing you need to do is code the diagnosis. So this search routine bar here in the middle allows you to search through the various codes directly. We're going to search for a diagnosis code related to diabetes. You can put as many diagnosis codes as you want. When you do the search, as you can see here, it shows up here in the search results field, which you can then scroll down and find. And we're going to just pick one. One more important thing you need to do is connect the diagnoses codes that you select with the service you provided. This is important for HDMS. The way you do that is with this justify column. You click that and select the diagnosis code, and you do that as many times as there are diagnosis codes related to this CPT. And that is all the coding that is needed. Okay, I'm going to show you what a couple of other features. That takes care of a standard visit. There are a couple of other nice features you need to know about. Looking up patients can be done right here in the search bar. You can, if you put nothing in there and just click on name, you'll get a list of all patients. The one I just entered, there's a test patient for playing with, and then you can just select that. The patient display line gives you some basic information, the number of encounters they have, and how long it's been since that encounter. You can also do the search based on their ID number, social security number, or any pattern match in their demographic record, or narrow it down to a specific pattern match. So if I wanted to look for just people with the letters GA and I wanted it in their state, you can go in here and say state locality and search for just the people with GA in their state. Of course, both of these have that, so it would have found it that way. So that's the search routine. There is some accounting activities that can be done at this point, including checkout, payment categories. I'm not sure if this particular clinic will be using payment categories, but if you do collect money at the door, there's a payment checkout feature right here that can be used to log your patients. That is really it for basic EMR usage for a visit. Established patient visit would follow the same pattern, only we'll go back to that just to show you. We'll look up now that the patient we just entered is an established patient. You can see that their medical problems, allergies, medications all show up here. You can enter a note saying, patient will return in 1 week for fasting blood test. It's a chart note, and we have that new note, and that note will show up here anytime you look up this patient. You can also address the chart note specifically to anybody in your system. So if this was a specific note you wanted the medical technician to see to be ready for them to come in or to call them for an appointment follow-up, you could do that at this time. There is another subset of this in the medical record that allows you to look up to produce a report on the patients. I'm going to turn the bottom screen off at the moment. So if you want to produce a patient report to hand to the patient or for an outpatient referral, this is the patient report screen. You can select the things that you wish to appear on the patient report. I'm going to report on their history, and each encounter will be listed separately. So you can list a separate encounter, you can list all of them. You click Generate Report, and you get a nice output of the medical record. The printable version cleans it up a little bit so it's easier to print, and that is that. The other thing you can do from here on this patient is a prescription. This is the prescription category. I'll turn that bottom. Here's where you can add a prescription. You click Add Prescription. You fill out the prescription and save it. It'll keep track of it. It'll also create a form which can be printed to be given to the patient. So. That concludes the basic workflow of a patient visit.